We're here to discuss bystander CPR in children following a cardiac arrest. In terms of whether they receive bystander CPR, how often they receive bystander CPR, who receives bystander CPR, so what age receives bystander CPR, what race receives bystander CPR, what type of cardiac arrests receive bystander CPR, where they occur, and how the kids do overall. Bystander CPR is basically layperson CPR, so it's when a child collapses, who performs bystander CPR on them. So this is not CPR that's provided by emergency medical services. This is really bystander CPR that's provided by lay rescuers, so family members, Good Samaritans, or lay medical people. One of the most important things in the chain of survival is, first of all, identifying that someone's collapsed and then calling 911. And one thing that's really changed in the last couple of years is what we call dispatch-assisted CPR. And this is where the dispatcher will really help you or help providers know how to teach them how to perform CPR till EMS arrives. In children, asphyxial arrests or arrests which are related to respiratory problems are more common than primary cardiac arrests. So it makes sense that rescue breaths or breathing will help children who have respiratory arrests versus a primary cardiac event where chest compressions only will help. So in children, lay rescuers are encouraged to perform conventional CPR. So conventional CPR is CPR that's performed with chest compressions and rescue breaths. Whereas in adults now, conventional CPR is supposed to be equal to compression-only CPR, which is where no rescue breaths are delivered. However, the AHA recommends that if a rescuer is unwilling or unable to perform bystander CPR, that it's better to perform compression-only CPR than to perform no CPR at all. One thing that we found that was really encouraging was that bystander CPR rates have improved over time. So previous reports suggested that only 1/3 of children that have a cardiac arrest receive CPR. We actually found that half of children who have a cardiac arrest receive CPR. So that's very, very encouraging. The other thing that we found that was very interesting was that infants, which are 50% of the children that have cardiac arrests, have no benefit from bystander CPR. So children who are greater than the age of 1 had an almost twice survival if they received bystander CPR compared to no bystander CPR, and an almost 2 times higher chance of a favorable neurologic outcome compared to those who didn't receive bystander CPR. However, we didn't see this trend at all in infants. So bystander CPR was ineffective in the infant, which is the less than 1 age. I think you have to do CPR in that age group, absolutely, but our work has important public health consequences. If CPR is not effective in this age group, then we have to do something to really prevent cardiac arrest. 50% of the children who arrest are in that age group, and it's important to devise strategies where we can prevent arrest in this population. What we found was that bystander CPR is definitely increasing in children, and it is definitely on the rise. There have been lots of public health campaigns in various states. So the perfect example is in Arizona. There was what's called the Saving Hearts campaign, and in that they went out to communities. The people who organized this went out to communities. They went out to schools. They went out to the media and taught people how to do CPR. And so we are seeing more CPR occurring in children. The interesting thing, as I said again, is that there's no effective bystander CPR on children. Another thing that we found that was very interesting, and again another area for public health intervention, is we found that there was a racial disparity in provision of CPR. Children who were white were more likely to receive bystander CPR compared to children who are Black or Hispanic. Again, an area for potential public health intervention in communities where there are more children or more people of Black or Hispanic or other minorities. That's an area where we should really be focusing our efforts on teaching bystander CPR. So this has been observed in adults, and we really don't know why it is. There are lots of things that have been hypothesized. So people think that it may be related to language barriers, it may be related to communication, it may be related to fear of being deported if somebody's not a citizen. It may be secondary to fear of criminal prosecution, or so there are multiple factors, but nothing's really been pinpointed. And our study didn't really address that. We just found that, and that's everything that I talked to you about is more in the adult world where this has been found, and what people think is most likely happening in the adult world. But again, our study didn't really address why this was happening. It really just found that we have this racial disparity. The people that this really applies to is public policymakers. So we really have to do something to increase awareness about bystander CPR. So whether this is in areas where racial minorities reside, and you educate parents. Again, the main people who are performing CPR were parents. It was lay family members in 70% of cases. So maybe in those areas we devote resources to educating families on provision of bystander CPR. People have been going out to schools to teach people how to do CPR, and we really found that children that had out-of-home cardiac arrests, that were adolescents, that were had shockable rhythms, so primary cardiac arrests, and witnessed arrests, they did incredibly well. Those children, more than a quarter of those children survived to hospital discharge and had an excellent neurologic outcome. So the focus should really be on two things. So one is providing education in communities, maybe targeting parents in some places, and in some communities where racial minorities reside. And then secondly, developing some sort of strategy to prevent sudden infant death syndrome in children. Again, 50% of our population that had cardiac arrest were infants, and the majority of those have sudden infant death syndrome. And again, bystander CPR is not effective in that population.